Okay, so we're here for the part 2. We decided to do a part 2 because it's going to be so long. With Doris Torres. So she is one of the owners of Skin and Skinnier. It's in La Jolla, California, which is where plastic surgeons go to succeed. Like, that's like the heart, right? Well, you don't know, but like, so it's funny because there's a lot of plastic surgeons like per capita in San Diego, and I think there's an awful lot in La Jolla.
Yeah.
And it was a Plastic and Reconstructive Surgery Journal podcast, and one of the guys he did expert testimony for cases. It was a plastic surgeon that gave expert testimony. This is, see, we're already on. This is why my videos are so long. So, and he said something, his thing about how you should be for expert testimony was, like, you have to be active in the industry. You can't just be a plastic surgeon that had a good career and retired to La Jolla. And I was like, oh, La Jolla. It's where successful plastic surgeons retire. Because there's so much plastic surgery here, and it's beautiful here. So anyways, it's a real long. If you're not from San Diego, we're in La Jolla. Instead of in my office, now we're in La Jolla in the offices of Skin and Skinnier. So we're at Doris's office. So Steve Torres is a doctor who specializes in liposuction and Brazilian butt lifts, and he started off in Arizona, and now he moved here because, why'd you guys move?
Actually, because we love sailing. And we have a sailboat in San Diego, and we're traveling back and forth almost every 3-day weekend. And we said, why not just move here? And so we did. In 2018, we moved here.
That's great.
We opened this place in 2019.
We moved here to be closer to your sailboat.
Yes. And we love it here. We will never go back.
Yes.
We love it here.
Yeah.
Yeah.
It's beautiful.
And
it's beautiful.
we actually met in Southern California 25 years ago. So it's kind of like life went full circle.
That's awesome.
On this move, yeah.
Aw, never back where you belong.
That's right. And
That's
sailing
awesome.
still.
And you can still, and the boat's right.
Yeah, it's close, yeah.
It's close, yeah. You can go there anytime.
Yep.
Good. So if you watch the first video, we talked a lot about the emotional state of the client. This is a really awesome video for me. So if you haven't watched it, definitely watch it. But now I have a bunch of more technical questions. So I want this video to be really good and valuable for the massage therapist that's doing post-op massages. Instead of you listening to a lot of stuff about me and my office and my technique, I want to kind of go upstream and talk to the actual plastic surgeon staffs and see how they hear the client's story. So the first question we're going to say is, what have you seen from your clients from the time that they're out of surgery, you send them home in their faja, to like when they come back for their post-op pictures, like what have you seen the importance of lymphatic massage in their recovery?
I mean, it's tremendous how it speeds up the recovery, especially in that first couple of weeks. And those are critical because not only are you not feeling well, but you're also just dealing with all the faja, and you can't sleep well. There's so many factors that go into it. And just really raising that comfort level early on makes a huge difference to the mental state, and also just the physical well-being and all that. So it is huge. I mean, it really makes an enormous difference. And so we're highly encouraging it, and we almost demand it, as much as we can, because we just insist on the importance of it. And it just helps overall. It just helps, your body really speed up. It's like accelerating the whole process. And why suffer longer than you need to?
Yeah.
It's well worth it.
Yeah.
And going to somebody who's really qualified is so important as well, because we don't really believe in people, having our patients sign up for 10 sessions and then they're locked in and they want them all back to back to back. I know that there's different schools of training and different thought on that, but we don't really believe in that so much. We think that the body is capable of picking up a lot of slack if you give them the right tools. And then actually a few massages are sometimes way more worthwhile than having them back to back to back to back. And your body doesn't even have a chance to really catch up.
And I think if I could interject, so It's interesting because I have taken clients from Dominican Republic, from Mexico, from Miami, and the doctors do the liposuction portion differently. So it's kind of like you should tailor how many massages you're giving and when you're giving them to which doctor did the client, what that doctor's kind of like MO with doing the surgery is, what their theory with doing the surgery is, how aggressive that they are. And I mean aggressive in this time in a negative way, because some doctors will just take everything out to where, and a lot of clients are like, yeah, take everything out. But like some doctors will just like do an extensive operation on somebody and not think of, it's almost, and I don't want to, it's not one particular doctor I'm thinking of, but like it's kind of like how much can you get in that container, how fast, because there's 6 other operations afterwards, and so that is the result that you can kind of get. But if you if you go to another surgeon, you can get a really beautiful result on the body, not having to go so quick, so fast, like in and out, because there's 6 other girls behind you, and get like a result that's beautiful without traumatizing the body that much. Yeah. And we could go into a conversation, which we're not going to go into, about like how good is really the fat if you're taking it out in a certain way versus another way. So, but what I've seen specifically with Dr. Torres is he works with low BMI clients, and he finds fat where they didn't even think they had fat. So it is surprising to clients how when he says how many liters they have removed, because they really didn't think that he could find all that fat. So what I'm doing post-op in the office is making sure with foams and with the proper garment that we get the result that Dr. Torres wanted, that he did all the hard work on, because I'm not letting any swelling come and stay in the area, because we know that if you get lymphatic stasis for over 6 weeks or over 2 months, it's going to attract new adipose tissue into the area. So I want to get the result that the doctor intended and that the client wanted, with as few visits as possible. Because, and it's a luxury with Dr. Torres, because I've seen, like, for every single case I see of Dr. Torres's, that the client is in really good shape when they come to me, mentally and physically and emotionally. So I don't need, like, a lot of the hand holding occurs at the office, and they have that support staff with them. And I let clients bring people into the office with them to the appointments, and I love how many clients are like they have someone that they're bringing to the office. They don't have to stay in the car, that drove them there, but they can come in, and then I will teach them the MLD, and there's this bond that's so beautiful when you teach somebody, when the client approves. Like, I'll ask the client, is it all right to teach, your mom, your sister, your boyfriend, your daughter, to do the MLD? And then so not only are they going to get the food for them at home, but they can help to give them the massage. And we know from the MLD, through research, that MLD will help to increase the pain threshold. So it's a higher level of pressure before they actually feel pain, and it'll lower the pain levels of somebody. So it's like, not only emotionally can that loved one help and support them, but also physically with the massage can help them.
That's really
and
great.
it shows emotionally to the patient, to the client, that someone is there caring for them. Like, literally, like, here's some water and I'm going to massage you a little bit. And even if they don't want to massage the area with liposuction, like, I always tell people, like, the neck and the shoulders are hurting if you have a Brazilian butt lift, because you're sleeping in a different way. So if mom needs a low back massage, if mom needs a neck massage, that's something even like your teenager can give you, because they're not really going to hurt like a surgical area.
Exactly.
They can feel a lot more confident because they know how to give someone a neck massage. Like they can give dad a neck massage, give your brother a neck massage. If they don't hurt, then like give mom a neck massage, and then she's probably going to be happy too.
Right.
So yeah, but my basic point is you have to kind of titrate the number of massages that the person needs based on your experience with that doctor and other clients that they have sent to you. And I have seen that Dr. Torres's clients do really well. Usually the incisions close in 2 to 3 days, and they're able to comfortably tolerate the MLD massage at 4 days or 5 days. And then they usually don't need, clients who have a lower BMI, who start with a lower BMI, usually don't need more than 2 massages a week, unless there's something that I'm fixing with the foams, if they had the wrong garment, and then there's an issue, and I'm fixing like an indentation, then I'd want to see them twice a week. But usually they are healing, like your lymphatic system, your whole body is beautiful. It knows how to heal itself. It has this innate wisdom, and you've turned it in the correct direction because you know you're healing. You're not going through like a mental crisis because you have support with you. And you've been, so this office has made sure in the interview that you are a good candidate for the surgery and you're in good health. So you usually will need the gold standard that I have for my practice is 2 massages for every liter removed. And I can usually slide in to home base a little bit underneath that, where I almost have to. And then you guys, you have some massages and you just like me and I'm a nice person. And then you're like, can I come for another massage? And I was like, you really graduated. Like, you're doing so great. And then, but don't you do, and I'll tell because it's like massage 4 and they're like, well, do you do like Swedish massage? And I was like, no, you can't be my friend. The whole point of going to Dr. Torres is that you get your result and you'll never make friends with me because there are no problems because you went to Dr. Torres.
Yeah,
so
no,
you'll have to go back to just like seeing me on TikTok and being like, I met that girl once, but I didn't need that many massages because I went to Dr. T. So.
Well, that's great.
So
we love hearing that for sure. Yeah, and it's a 2-way street. Literally, we love referring Kathleen White because she's amazing. She treats our patients so well, and they get the best treatment that they could possibly get. So. It's a no-brainer. We don't get any personal benefit, but because we're invested in our patient's outcome, we want to make sure that they're going to the right person that, really, just does the best work they can post-operatively as well and helps them heal as fast as possible.
And it's fantastic. If you get a good relationship with the surgeon as a massage therapist, it's so easy because I know if I see a seroma, if I see any issue whatsoever, if they have an infection, if I think that anyone needs to be seen in any part of the surgery, like I know they can text Doris and get into this office. And we know in a lot of, like Miami is a particular place where for a lot of places in Miami, if you go to certain places, and I'm not the first person, I won't be the last person to say this, but I've heard a lot of horror stories online of, they're real friendly to you until you put your deposit on, and then you go and actually see how many people are in that waiting room for the day, and maybe you don't meet your surgeon until the day or the day before, and then afterwards you never see anybody again. And the amount of times I've heard clients say that they went to surgery in Miami and they got ghosted. Like they went to surgery overseas, but it's more frustrating because it's Miami. And then they got ghosted, and their surgeon won't talk to them anymore. And then they're asking us questions on the internet.
Yeah, they're asking us to drain seromas for their patients from Miami, and of course we're not going to do it because they're not our patient.
Yeah, but even like an individual question, you cannot even get one question answered. So that's why, like, I only want to have a professional relationship where we share a client with a surgeon that I know that if I have a question that can confidently tell them, you can just text your surgeon, and I know it's taken care of. I know I'm not going to hear an email 2 days later, I really think I have an infection, can you help me? That's the ideal, like that's what clients need to start demanding.
Absolutely.
You cannot shop on price. And you cannot shop on before and afters. You have to shop on full relationship, like the full from the very moment you call the office to the very moment where you're like, this is an amazing result. And you'll see that because people after Dr. Torres will like be posting pictures and be like hashtag, they'll let you know which surgeon they went to because they had a good experience with them.
Well, it's funny that you say that because a lot of times, you know, people are all hush-hush. The patients don't want anybody to know that they've had surgery. And we ask them if we can take pictures and sometimes take videos and all that. And a lot of times early on they will say, oh, no, I'm not really comfortable. Nobody really knows I got it done. Yeah. And then their confidence just blossoms as they see their new shape and everything. And it's just so fun to see them like post selfies and they let us tag them. And, you know, they're totally good with it afterwards, which is awesome. But at first they're all shy and they're not sure that they want anybody to even know. And then pretty soon they're like, I'll tell the whole world now because I love my body now. So it's neat to see those, you know, emotional transformations too, where they're now like, they're totally sold on the whole experience and they love it. That's awesome. So it's cool to see that.
So what about foams?
So foams are your friends. That's really what I tell my patients. Foams are your best friends in the faja. So you want to always wear the foams and just keep packing them in there as much as your body needs it. And we do snatch people pretty well here. So there's, you know, creases showing pretty quickly, like within a week or two is usually when people really need to make adjustments to their garments. And we either have them tailor their garments to the first one that they wear right after surgery, just bring it in the waist or at the skinny foams, depending on really what the patient needs. If they're really skinny, then they can definitely get some skinny foams in there, which are basically additional foams for the waist, just to bring that in more. But our key is to not over cinch on the waist because the waist is way more forgiving than your booty. So once that fat's gone, it's gone for good. And so we want to preserve the space. This is why I don't have people downsize too fast. I'm just adding foams. I'm having them add foams to their fajas because I want them to really have booty space. And the waist usually really, it does come second in this process because early on is when the fat loss is at greatest risk. And so we just kind of tailor our plan to that. But everybody's different. So I guide people individually. I literally have people text me photos of what they're looking like with garment, without garment. So I know, and I see problems. I had a girl yesterday put her back foam, like the backboard, in way too high, and it was like mid back, and I said that needs to be right over your booty crack, and it needs because we want it to really shape that area, and so she was really grateful. But had I not seen a visual of it, I wouldn't have known that that's what she was doing. So really keeping in contact with my patients to me is so key, and getting the visual input as well, so that I can help them as much as possible.
Absolutely. I see it's those little details because I get these comments. And they're nasty comments, and I get it. I'm not angry at anyone who leaves nasty comments, like on my TikTok or on my Instagram. I think it was on my Instagram, but they were just like, I don't have any help at home. I'm just trying to ask a question. I don't get a straight answer. Like, this is so frustrating. And you can tell that that's the end stage of someone who honestly chose the wrong doctor. Because if their surgeon ghosted them, they can't find any, and their surgeon never told them to get local post-op care and never reminded them to get post-op care before their operation, and then ghosted them after their operation. And it's the final step where you're now on a random person's Instagram account trying to get information about a very specific foam, that the reason why I don't give information about textured foams is because you need to have, like, someone needs to give you specific instructions on how to wear them, or else you're going to get bruising from them. So it can't be a random person on the internet asking me about something, buying something online. Like, it all goes back to the fact that you have to have a quality plastic surgeon at the beginning.
And really, I would be super offended if I had just one of our patients just asking these questions out in the community because they know they can come to me for that. And we will give them the advice that is tailored to their procedure and their particular experience in their recovery. Yeah. And so, I hope that that's not the case. That we have people out there, leaving.
No, it was from someone in Miami. Like, I'm pretty sure their surgeon was Miami.
That seems more typical, for sure. Yeah, I wouldn't expect that from us because even Dr. Torres would be, quite offended if he found out that.
Surprised, very surprised, because it's not like Doris didn't text you this morning. Okay, so how do you, because you're the first contact for a lot of people, and you're the longest relationship in their relationship with the office. So how do you mentally prepare people for surgery?
Well, I have a video that I made. It's on our YouTube channel that basically talks about the ups and downs of a surgery experience, and it is inevitable. You will go through some ups and downs, and just knowing that ahead of time, that it's not going to be all fun and games, and it isn't going to be always linear, in the recovery. That is really critical. And it's the same with your physical appearance. It is really, we call it, trust the process, and for a reason, because it's not linear. Sometimes you have 3 great days and you're seeing a lot of snatching going on, a lot of tightening, and then you're stagnating for a while, and that's normal. And it's just your body doing its thing. Yep. And so just understanding that and being accepting of this whole situation ahead of time, I think eliminates a lot of the frustrations, in the recovery process. Just having the right frame of mind and knowing that it's not going to be easy. It's not going to be easy for most people. I will say some really fly right through, but I would say 2/3 of people do struggle at some point in time, and it's normal to feel a little bit discouraged and get a little bit depressed about the situation. It's a situational depression. Yeah. But people bounce back, and I always tell them, keep pushing through. You're going to get through it, and you're going to be better in a few days or a week or two, and that's just usually how it goes. It is a process, and we just got to hang tight.
Yeah. So I have, in my YouTube account, I have some guided meditations that people can use for before and after plastic surgery.
That's right.
Yeah, and I find that that's very valuable because what I've seen and heard from my clients, and I'm having my own plastic surgery in December, is that it's always a thought in the back of your mind, and it's the craziest thought. Like, I picked the best surgeon. I know this surgeon. I trust this surgeon. But it's like, what if not? It's like what if I go through the whole thing and then I look exactly the same? Or what if I never wake up? Or what if the pain is too much after surgery? And from everything I've heard, in this 72 to 90 hours before surgery, that's when it comes to the forefront, and that's all you can think of.
That's right.
And that's the point at which so if this surgery is coming up for you or for your clients, have this as a resource in your pocket, this plastic surgery guided meditation that focuses on the fact that you are going to get through it and you are going to heal. And then that's what you think of when these random thoughts start coming and becoming more and more intrusive.
That's exactly right. And you just reminded me, we actually have a link in our pre-op instructions on
those
too. Yes. Yeah. I do find it really, really valuable. And the one thing is, just before the surgery is when all these anxieties come up, all these questions, all the what if scenarios, and people go through it. And we've had a patient come in for her pre-op exam on a Friday evening and actually backed out. And she said, I don't think I can do it. I'm not going to be strong enough. And literally we texted all weekend back and forth. And then on Sunday night, she texted me and she said, I still want to move forward. I've had my powwow mentally, and I'm ready. Good. And I said, good for you, but we understand, and we would never want anybody to do it if they're not ready. So, but it is normal to have certain anxiety, right? Especially the last about 3 days before the procedure usually, and that's why I reach out at that time to let people know I'm here for them. And it's a lot of times it's just like random little questions, and if they get an answer within a couple of minutes or within an hour, I would say, it makes them feel at ease. And they're like, oh, they're answering my questions right now. And now I feel better because that question is answered for me.
Yeah.
And it's really those little things. A lot of times they're small questions. They're like, you know, something they could ask during pre-op as well. But having that question answered already, especially on a weekend, and if they're coming in for surgery on Monday, it's just nice to have that personal touch and knowing that somebody's going to be responding.
Yeah, and that there's support. There really is, like, it's a little test.
Yes.
And then but they really are going to text over the weekend. So like maybe it's not a lie. Yeah. Maybe you really are going to support me.
Yeah, exactly.
Yeah, it's great. Yeah, it's really good. Okay, so specifically what you guys do here is wake liposuction, which is awesome. If anyone is talking to me about liposuction, awake is superior from the full body anesthesia for so many different reasons. You're ambulatory immediately after. You're literally walking out of this office after your surgery. Just read the published research with respect to like incidents of blood clots, which is what a lot of people are scared of, incidents of anything going wrong with the Brazilian butt lift or the liposuction. Like, you being present in that operation is so highly beneficial to you. Yeah. So I love the concept of awake lipo, and I know outside of this office, even other surgeons that are doing surgeries that you'd be surprised, but they can do it awake as well. So I think it really is this vestige of, like, I'm scared of surgery, I want to be completely asleep, I don't want to do it. So it's more of a mental than actually a physiological reason why you would do a sleep lipo versus awake lipo. Exactly. But that is still, some people, it's that innate, I think it's that gut feeling, like, no, I want to be asleep. And then, like, what would happen if I was awake? So how do you prepare people, or what do you say when they talk about that? Well,
we prepare people really through our social media. We're super transparent about how the whole process works, and it's the real deal. I'm in there taking those videos typically, and it's really, we're having an interaction with the patient. A lot of times when I do take a video, I won't talk to them because they don't want to be identified. But if they are, great. But, you know, we're really showing the way it's done, and that, I think, if somebody says, well, I don't know if I can handle this awake, then I always, you know, encourage them to watch our videos, because they're real patients. You know, they didn't get paid to do this. They're the real deal, and we love to show what it's really like. And there are so many benefits to doing it awake. There really are. But it does take a certain person to do it awake. I will say that it is not for everybody. Some people just cannot handle the sight of this long cannula, you know, this big rod going through their subcutaneous tissue. That freaks them out, just the sight of it. So if somebody, like, has an anxiety attack over that cannula, they're probably not going to be okay. But we do give an anti-anxiety medication beforehand. So it really helps people relax and care a little bit less. They're still totally making sense, and they're a little loopy, but not bad. They're just a little bit sleepy, rather. And so when they do that procedure, it's really the first 20 to 30 minutes that are a little bit intense. It's the numbing period where Dr. Torres infiltrates their subcutaneous tissue with the tumescent solution, which is mostly saline, with some epinephrine and lidocaine that numbs it, and also restricts the blood vessels a little bit so that they don't bleed very much. But it is done in a very gentle way, and every pass is literally, the patient is already numbing that area now, and then he goes right a little bit next to it. And there's an art to that. And if you do it really gently, and you're working with the patient, and you let them know you're not going to harm them, this is how it's done, and then pretty soon they feel pretty numb, and they become used to the tickling, the vibration, and just the feel of it, because it is unusual. It's nobody has really experienced that before. And so they're like, oh, this feels weird, but it's not so much the pain. And Dr. Torres always reminds them, is it really painful? And they're usually saying, no, actually it isn't.
Yeah.
You know, so it's their mind that tells them it is painful, but it really isn't.
Yeah.
So that's one aspect. And then the other thing is it's really hard to perforate somebody's abdominal wall when the patient is awake. Because guess what? You're going to contract your abdominal muscles ASAP as soon as that cannula hits it. And you will feel that. Occasionally he bumps the muscle, but he's like so gentle and so controlled that it doesn't really
go.
It'll, I mean, when the patient is awake, and I always say that, I know it sounds brutal, but you cannot butcher a patient when they're awake because they're fully aware they're talking to you the entire time.
Yeah.
They know what's going on.
Yeah.
So you have to be gentle. There is no other way to do awake liposuction but gently.
Yeah.
And I think that is a huge key, and I think it is really important with how our patients recover afterwards too, because the tissue trauma is simply not as much.
Absolutely.
You know, it's not as extensive.
Absolutely.
Yeah.
Okay, so I have 3 more questions for her, and that will be in part 3 of this interview. But isn't she awesome? Isn't this great, having an inside look at what happens at one of the top Brazilian butt lift establishments in La Jolla, which we have said is